For shoulder external rotation, your partner should lie supine with their shoulder abducted to 90 degrees and their elbow flexed to 90 degrees. You place a towel under the humerus so that the elbow is level with the acromion process. The axis of rotation is the olecranon process. The stationary arm is perpendicular with the floor, and the mobile arm is aligned with the ulnar styloid process up here. So when shoulder external rotation occurs, it occurs in the sagittal plane around the medial lateral axis. Go ahead and externally rotate. So lined up, you can see that he is at about 90 degrees for external rotation, and the normal range of motion is 90 degrees. For ankle inversion, your partner will sit on a table with their knees slightly bent and their ankles hanging off the end. You will find the axis of rotation between the medial and lateral malleoli along the talocrural joint line. The stationary arm will line up with the midline of the leg here, and the mobile arm will line up with the second metatarsal. The inversion happens in the frontal plane around the anterior-posterior axis. Go ahead and invert. Keeping it straight, this lines up. He's at about 20 degrees of inversion here, and normal is about 30 degrees. For cervical extension, your partner will sit in a chair with their head in neutral position. The axis of rotation is the external auditory meatus. The stationary arm is aligned perpendicular with the floor, and the mobile arm is aligned with the bottom of the nares. Go ahead and cervical extend. So you can see here that he's about 46 degrees of cervical extension. Normal is 60, and cervical extension happens in the sagittal plane around the medial lateral axis. For the manual muscle test for the Latissimus Dorsi, you'll have your partner lie prone with their arm at their side and the palm facing up. You can palpate the lats and the lower back where they originate at T7 through L5 vertebrae and the iliac crest of the hips. And then they insert up here into the insertion point in the intertubercular groove of the humerus. The action of the Latissimus Dorsi is to adduct and medial rotate the humerus as well as extend the shoulder. So first we'll assess normal range of motion. Go ahead and reach down to your toes and then come back up. So that's normal range of motion. Now we can have him reach down to his toes and hold the position. I'll place one hand proximal to the wrist joint and one just above the elbow. You push down and I'm going to resist up. So he was pretty strong. This motion occurs in the frontal plane around the anterior posterior axis, and for this manual muscle test, I would give him a 4+. For the anterior tibialis manual muscle test, you'll have your partner sit on the table with one leg off the edge and one of their heels on your knee. The anterior tibialis can be palpated from its origin at the superior tibia down to its insertion at the medial cuneiform and the first metatarsal here. The action of the anterior tibialis is ankle dorsiflexion and inversion. First of all, we're going to assess normal range of motion, so go ahead and dorsiflex, release, and invert. Perfect. So normal range of motion has been assessed. Now we're going to put one hand behind the ankle here and one on the medial forefoot. Go ahead and dorsiflex and invert at the same time. You hold that position while I resist you in plantar flexion and eversion. Still pretty strong, but you could pull it with extra force, so I would give him a 4+ or a 4 on this manual muscle test. For the obliques manual muscle test, you'll have your partner lay supine on the table with their hands clasped behind their head. We can palpate the obliques on each side here of the abdomen. The external obliques originate at the ribs 12 through 4, and the internal obliques at the thoracocolumbar fascia and the iliac crest here. The external obliques insert on the linea alba and pubic crest and ASIS, which is down here, and the internal inserts at the linea alba, which is back here, pubic crest, and ribs 9 through 12. So they're both on the sides here. The action of the obliques is to flex and laterally bend the trunk. So we're gonna assess normal range of motion first. So go ahead and sit up, bringing your opposite elbow to your opposite knee. Perfect. So normal range of motion has been assessed. So for the test, you're gonna curl up as far as you can, again with the same motion, bringing your opposite elbow to your opposite knee and hold the position. So for this manual muscle test, you have to have the medial border of the scapula off the floor as he holds this position with his hands still behind his head. So you can release now. Since this happens in the transverse plane and the sagittal plane, there's two axes that he rotates around. His medial border of the scapula was raised completely off the ground, so he gets a grade 5.